Hey guys, it's Judy and Dr. Jeff from Whole Body Health, and we are going to teach you how to do the FAST technique today, which is a great way to diffuse any sort of charge on an emotion that you may be experiencing, and it's very effective. So, Dr. Jeff, take it away.
So FAST stands for First Aid Stress Technique. Something we learned when we were doing our training for neuro-emotional technique and utilizing that to help decrease stress, and which will take stress off the body. If you're feeling a lot of stress in your physical body, or you're feeling just a lot of stress and tension in your body with all the stuff we've got going on, this is an advanced technique to help reduce that stress, kind of pull you out of that fight or flight and freeze and move you more into rest, repair, restore, trying to just calm your system down. A lot of times you'll notice a difference in your physical body when you do utilize this. So there's pulse points on the wrist, acupuncture pulse points on the wrist, and there's 3 on each wrist. And the landmark I use is the crease of the wrist. So where the wrist bends like this, that's where the first pulse point is. And you can kind of just set your fingers right next to each other on each wrist to utilize the technique. And so what we'll do is we'll have Judy go through and think about something that's stressing her out and just rate it on a 10-point scale, if you could do that. And so while she's doing that, I'm also going to ask her to determine when she's thinking about what's stressing or creating stress in her system, where she's feeling it physically. The most common answer I get is tension in the jaw, tension in the chest, tension in the diaphragm, sometimes in the abdomen, sometimes in the neck and shoulders.
So it's an 8, and I would say I'm feeling it mostly like in my neck.
In your neck, okay. And so what we do is we're just going to have her reach around and grab the pulse points on the opposite wrist. And so she just settles in, just a firm squeeze. She doesn't need to crush her wrist. We don't have to break any bones. And then she's going to take the palm that's open and put that on her head. And a lot of times what I do is I like to lean people forward, and we got her resting on a pillow. And she's going to just kind of think about everything involved with that stressor. And while she does that, I'm going to encourage her to do nice, deep breathing, primarily in and out through the nose. She can do it in and out through the mouth and into the back of the throat. I really like utilizing the nose. Nice, slow, deep breath. Want to make sure you're focusing on everything that's going on with that situation. We want to take it from the number that it was. It was like an 8, 7 to 8, and we want to reduce it to about a 2 if we can.
And then when it starts, whenever the number starts decreasing, so I started at an 8, and as I start breathing through that and holding these points, I can feel the tension starting to decrease, the charge, like it's decreasing from an 8. Then you can switch around to the other wrist.
Usually when it plateaus, you want to switch to the other side. So she felt it plateau, and it stopped going down, and so she's going to go to the other wrist points, pulse points, and she's going to continue to breathe. And I'm going to give her some space to do that. One of my favorite recommendations for patients, especially patients with kids, is to do this technique in the bathroom. Unless your kids are 4 or 5 and under, usually you don't have people beating on your bathroom door trying to get your attention when you're in that room. If you are, maybe you should be doing FAST for those people beating on your door when you're in the bathroom. All right, so what number are you at now?
Yeah, it's like a 2.
Yeah, how does your neck feel different?
It doesn't feel as tight.
Yeah. So there's a viscerosomatic response, or emotional somatic response. We can have things going on inside of our body or emotionally that will create a stress response in the physical body. And so this is a phenomenal technique to help work on that and release that. And so I would recommend you do that, especially in this time where there's so many things that feel like out of control. There's so much uncertainty. We'd really encourage you to use this technique to help you kind of get through this time. Thanks for joining us.